And as the world marks the Cancer Awareness Day, an appeal has been made to ensure that the National Institute of Cancer Research and Treatment Bill is implemented for the effective coordination, control, diagnosis and prevention of cancer in Nigeria. And to discuss the global health challenge, talking about cancer, we're now being joined by Runcie Chidiebere. He is the Executive Director of Project Pink Blue. Thank you so much, Runcie, for being here. I know you've been busy, so we really appreciate you coming into the studio to have this conversation, because it's a conversation we need to have.
Yeah,
WHO, harrowing statistics, 20 million people and 10 million died.
Yeah.
Why has it become so prevalent, especially in our climes, and why are we seeing more deaths from cancer?
Yeah, thank you very much, and really appreciate Arise TV for the wonderful work you're doing, especially in picking up very captivating and very neglected news and making it a very front page news. That's really important. You see, the issue is more Nigerians and more Africans are beginning to be more European than the Europeans. We're gradually changing our lifestyle to suit what we think is the most interesting way to live. We've deviated from eating the things that we are used to. That is one reason. So that lifestyle issue needs to really be addressed. Number two is awareness has increased. So since awareness has increased, more people are now going out to get diagnosed. And once that happens, the number will rise to show that people are beginning to be more aware. Previously, or several years ago, many people are diagnosed with cancer, but they eventually die with it. And really, people don't even know if they died of cancer. So this is really a very pathetic, statistics. It's really worrying, because Nigeria actually contributes to the highest burden of cancer in the whole of Africa.
And that's quite troubling, especially looking at the data right now. It says when you look at the stats between men and women, we have more women, 3 to 1 at the data right now. I want to know why that is. And also, the cost of the treatment of cancer really is quite expensive. Looking at the millions one would have to spend now. So how can those costs be augmented for people? I know that is a bill that you're pushing. So talk to us about the prevalence in women and, of course, that bill quickly.
Yeah, so the prevalence in women is actually because breast cancer in general is actually the leading cause, the leading, in cases of breast cancer all over Nigeria, right? And in some part of the world, in some part of the world like Europe and all the rest of them, lung cancer seems to be leading. So that is actually the issue. Then secondly is cervical cancer. Cervical cancer has been described as the cancer of the poor people. The reason is because most part of the world today has actually eliminated cervical cancer. Australia, for instance, there's no cervical cancer there.
That's the one that is still treatable if you catch it on time.
No, it's preventable. It's 99% preventable with the human papillomavirus vaccine. Unfortunately, in Nigeria here, for you to get a human papillomavirus, you have to pay about 10,000 to 16,000 per dose, because this vaccine is not included in the national immunization routine.
So let's talk about that bill.
Yeah. So actually, the bill was actually passed by the National Assembly in 2017. And the title of the bill is the National Institute for Cancer Research Bill. And it was signed by the President in December 2017. And this institute is so important because it will help to guide, to provide direction, to ensure that cancer control is more coordinated. At the moment, as we speak, very few state governments are doing anything about cancer. But if you go across the country right now, you see almost every state has state agency on AIDS control of HIV/AIDS. Because why? Because Obasanjo actually, started the National Agency for Control of AIDS. So for cancer, a disease that kills over 100,000 Nigerians every single year, is being managed by a small desk in the Federal Ministry of Health that has less than 20 staff.
And of course, if you even look at the facilities where cancer treatment is supposed to be gotten, especially at our tertiary institution, it's quite unfortunate looking at the state of it. But you know what? At the end of the day, health experts will tell you prevention, when you look at cancer and early detection, is the best way to go. So what more should we be doing? Talk about us as a people and the media in particular, really, in a minute, what we can do more to prevent cancer, really.
Yeah. I think the core thing we all have to do is to ensure that the same way we take care of our bicycle, we take care of our motorcycle, we take care of our car, we change the oil. That is the same way we should take care of our body. Our body is so important. It's actually what you give your body that it gives you back, right? And I keep saying it, health is such an important thing. It's actually only a healthy person that can fix the economy. Only a healthy person can carry camera. Only a healthy person can go to the market. So we all have to be very sensitive, especially with the rise of cancer.
Runcie Chidiebere, I would have to say thank you so much for being here. And well done for all that you're doing.
Thank you so much.
Hopefully we'll see that dream of yours come to fruition soon enough. So we reduce this death. We're seeing 100,000 a year.
Yeah.
Troubling. Thank you for being here.
Thank you very much.